3 panelists as well. So I'm going to go ahead and introduce them. So first panelist is Kaity Stone, pronouns she, her. Kaity is a licensed clinical social worker, acu-detox specialist, and founder of Open-Minded Counseling. Kaity provides affirmative, inclusive, compassionate care for individuals, families, and couples with a special commitment to the LGBTQIA+ community. The next panelist is Kate McDougall-Pillai, who is my coworker, but I cannot pronounce her last name. Pronouns she, her. It's been a long day. Kaity is a licensed professional counselor and LPC supervisor with over 20 years of mental health experience. She offers trauma-informed care and is nationally certified in EMDR, which is eye movement desensitization and reprocessing therapy. Kaity is a part of the LGBT+ community and specializes in LGBT+ concerns and issues. Welcome, Kaity. And then our last panelist is Kelle Tillman, pronouns she, her. Kelle serves as the Chief Clinical Officer for the Help Center for LGBT Health and Wellness. Kelle is a board-certified adult and gerontological clinical nurse specialist and is credentialed as an HIV specialist with the American Academy of HIV Medicine. She's a driving force for patient-centered healthcare for the LGBTQ+ patient population. She has a lot of letters after her title, and if she's okay with it, I will not read all those. She has a PhD. We'll just leave it at that. Okay, so this panel, first question, and please, again, as you wish, please get questions passed to the side, and I'll try to kind of ingest them into the dialogue here, and we'll just kind of free flow along here. But this is the first question to Kelle. What are the biggest issues you currently see facing LGBTQ+ health from your daily encounters here at the Help Center?
Okay.
I think it's on.
So from our daily encounters here, I think some of the biggest issues are, there's a lot more access for the LGBT community in healthcare in Dallas than in Fort Worth. That would be number one. I think specifically in regards to primary care services that are very individualized for that. We have put out and we've reached the goal of it for the sexual health needs. Our clinic, we provide PrEP services, we provide HIV care, behavioral health services, gender affirming care, specifically to the LGBT population. We've also expanded in that we have STI clinics for the community as a whole in regards to try to identify other individuals that we can get linked into care for our PrEP services or our HIV care, but we do that for the community as a whole. So I think some of the biggest struggles, honestly, are that access for individualized care. It's something we'll talk a little bit more about, but because healthcare is not just healthcare, it needs to be individualized healthcare. We also recognize for our end that we haven't done as good a job trying to provide for the lesbian population. We have worked this year, we've gotten a grant from the American Cancer Society recently, and we are really excited to roll that out in that program that will be able to provide free pap smears, free women's health exams, targeted for the lesbian population. And we provide all of our services at no cost. So, but what we do.
Regardless of insurance status?
Right.
Sorry.
Thank you.
Because people ask me that. All right, next question, thank you, is to Kaity and to Kate. So I'm gonna kind of group you all together because professionally you're similar, but obviously gonna come at it with slightly different angles. Can you share mental health strategies and tools that uniquely would help our LGBTQ+ community?
Hello. At our clinic, again, making this available and free to our patients, and in circumstances where people have lost insurance or are waiting to get into a mental health facility, an inpatient or outpatient care, making this affordable or making it free for, in our case, I think that's probably the best thing that we got going. You know, being a bridge, especially if someone's lost a job or, you know, their insurance, their deductible is $3,000. How can they get the mental health care that they deserve? We do DBT and cognitive behavioral therapy. I am an EMDR therapist, so making trauma therapy from someone seasoned, somebody part of the LGBT community, I think is so important. You know, a lot of people are scared to reach out to find mental health providers if they're a non-citizen. That we have a bilingual therapist, we have that here, and free. So I think that's how we're meeting so many things. Alternative methods, which that's a perfect segue to you. I think we have so many beautiful ways of integrating alternative care.
Nice handoff. Perfect.
Yeah.
I gotta say, I love that the therapists are after the legal and the advocacy, so well played, well played. Good time. I appreciate that. My first tip is to turn off the news. Limit your feed, limit what you're taking in, know what you need to know, and then know what you can step away from, because it's a lot. And that's just for own self-care purposes, pulling back on some of that and then plugging into your local community. So just being here, I know just walking into this space, I'm gonna feel better being around all you amazing people, just gives me hope. And just really encouraging people not to silo up, that it is a scary time, but we have to get out there more than ever to be around our people. I'm a big provider of mindfulness services and meditation and grounding techniques, which I think is even more pertinent now, more than ever, of knowing how to center yourself, no matter where you are, because we're around all different climates. So with that, I'm actually gonna have y'all take a few breaths with me, because I'm a doer type of person, and it's been wonderful information, but it's a lot of information. So I just want to take a minute just to have you ground yourself with just a few grounding breaths. And you can put a hand on your heart if you want, or in your lap. Kind of put both feet gently on the ground. If you want to close your eyes, you can. If you want to leave them open, you're welcome to. And we're just going to do about 5 deep breaths, and I'll guide you. So take a deep breath in, hold for a second, and out. Holding on the out, in. Hold, out, hold, in, hold, out, hold, in, hold, out, hold, last cycle, in, hold, out, hold, returning to your natural breathing, gently opening your eyes, and just taking a moment to notice how you feel. I always love feeling the shift in the room after doing that, and congratulations, you all just did box breathing. Walking away with a meditation skill. That one is one of my favorites because you can do it anywhere. I teach people to do it on their leg, because if you're focused on that count, cannot be other places. It's a really, really powerful grounding tool. So thank you all for doing that with me.
Don't forget your
my back. Yeah, so I also do AccuDetox, and people look at me like, what is the ADS? So AccuDetox, it's a 5-point ear acupuncture for mental health and wellness. It is amazing. It is not new, but we are bringing it back. It comes out of the substance abuse and recovery world. It's a trauma modality. They did it after 9/11. They served 40,000 people. The VA actively does it. It is an unbelievable tool. I do it in a group of people, and I've just seen just amazing experiences. It's nonverbal, so people don't have to talk. You can come and get it done, sit for 20 minutes, and not speak on anything if you don't want to. But it promotes balance and clarity, and it is very holistic and intuitive. It's about finding that healing that we have inside us and just tapping back into that. So you'll see me, if you follow me on Instagram, I try to really be out in the community because I really want this out more, to have the accessible tools. Mental health is fantastic, but not everyone wants to nor can afford to come see a private clinician. And this is a way to go out in the community and get these services in a variety of ways. So keep an eye out for me. I'm bringing way more to Fort Worth. It's really something special. Thank you.
So I'm gonna ask this question, but before I do, just another request from the audience is, if the panelists can just talk to the mic, cause it's kind of soft sometimes, so if you just hold it, our mics aren't the best. So this one's to Kelle. What challenges is the health center facing in light of the recent and proposed policy changes at the national level, in the sense of how that affects the care we provide, if it does at all? Just riff on that.
Go on, Rip. Rip is right. And that gets a little difficult because we all know it changes daily, but we don't want to turn the news on every day and see what, so I rely on Nathan to keep me updated and let me know what's rolling out and changing, so I don't have to turn my news on. So one of the biggest things we've seen this year is funding, as you could well imagine. You know, we, for some people, I'm not sure if you're aware, but on May 31st, we were notified at 4:45 in the afternoon that we could not spend one more dollar of our HIV prevention funds because the state had not been funded federally. Many programs for HIV prevention in the county and the state, completely people were laid off that day, or Monday morning, because they could not sustain those programs without that funding. Many of these programs are completely dependent on that funding. We're very fortunate strategically that we were not dependent on that, so we were able to absorb those individuals' salaries in that program within other budgets of our organization. And it's just extremely frustrating because the way all that rolled out is just people that are not thinking through the whole process of when they make one decision, what that affects going downwards. But so funding, that did come back to us at the end of July. And so we do have that back, which is great. But again, funding issues are huge. We have a program where we provide insurance subsidization for people who are not able to obtain their own health insurance through ACA plans. There's a lot coming down over the next year about how that's gonna be impacted. Are those same subsidies gonna be provided? Are we gonna be able to provide that? And then not even from the nationally level, but even private organizations. So drug companies that make the medications that our patients need, they have placed restrictions, and that they have decided now that things that they used to do to help organizations like ourselves, where a portion of the large revenue that they create from their medications has to come back to organizations like us so we can provide the care we do. They've now decided that they want to keep all that, and so we're not able to get some of that revenue for those uninsured patients. So many things with that. You know, January we already had to immediately restrict our gender affirming care appointments to individuals only 19 years of age and older, no longer to our 18-year-old individuals, even though at the Children's Hospital and other facilities they turn them out at 18. And then our undocumented patients, we're not really seeing an impact of that, but we're being very mindful, very concerned for the potential impact of that for undocumented patients, providing lots of reassurance to them about confidentiality. We have really not seen an impact of it decreasing the number of those patients coming to us, but other organizations and colleagues I work with, we're also being really strategic. I mean, are they more comfortable doing a telehealth visit so they're not risking coming into an organization, really assuring them the confidentiality of all of their information. So, and we even see that impact, unfortunately, with our employees. And so really being mindful and being supportive of all individuals in regards to these issues and changes at the national level.
And just a requested point of clarification, I guess, from the audience, or for Help Center's mission. Their question came from the audience: do we provide just preventative care for HIV, or do we provide HIV care?
We provide HIV care as well. Help started just originally in 2017 when we started our PrEP services. Originally, Help was just HIV prevention and outreach. In 2017, we started PrEP services because there was nothing like it in Tarrant County. People had to travel to Dallas. We started it as a pilot program. We did it on Tuesday nights and Saturdays just to see what the uptake would be. Our goal was we would have 100 patients in the first year. We had 500 patients in the first year. So immediately opened up a full-time Arlington clinic. And so then it was really funny because we had a lot of patients coming from Dallas, but they still would want to come from Dallas to Fort Worth because they would want to see specific nurse practitioner that was working in Fort Worth. But in Arlington, the program has grown a lot. So then in 2020, when I came on full time here, we opened up the Fort Worth location, really noticing and identifying patients that we would diagnose as living with HIV. The linkage to care was a big delay. When I would have to refer them out to other organizations, that would be a linkage to care delay when I could rapid start them on medication right away. And so we started taking on those patients as well. So we have a small patient population living with HIV that are in care with us, but we do take those patients on, specifically the ones that we identify, so we can just keep them in care. And then we've had some patients transfer into care from us from other providers as well.
Thank you. So this question's to Kaity and Kate. Are you all seeing growing impacts to members of the community's mental health given the current environment? And if so, I think you've already provided one, just turn the TV off, but beyond that, or stop reading the news, what are some of the most effective ways to deal with those? Let me add on that, I guess, me riffing. How do you stay engaged and informed, but not become overwhelmed?
Well, I think the tactic is to isolate.
I'm asking for a friend.
I think the tactic is to make us feel isolated, to be gaslit. I'm caretaking for a family member right now, and just hearing Fox News on 4 different TVs for weeks on end, I'm done. But they're getting manipulated, they're not hearing full truth, and they're making it sound like, well, they're gaslighting us. That's what the media is doing. So it is important to find alternative ways to get your news. I'm a big, I'm nerding out on Substack right now. If y'all haven't found Substack, it's epic. I was watching it all yesterday because all the protests, yay! So I don't think, and I remind clients all the time, sometimes you gotta take a break. You gotta take a break. DBT counseling, we're always looking at, okay, you can be anxious and still make an event. We can work on doing both at the same time. You can have 2 emotions at the same time. You can have 2 feelings at the same time. It's about regulating, teaching the skills, how to be okay. Is that a tiger eating me, or is that something that I'm imagining that possibly could have happened 10 years from now? Regulating and finding ways to catch the body up, because a lot of people don't realize once you've been triggered, it takes 10 to 15 minutes, sometimes 20, just to get your heart rate down. So a lot of techniques like that. So I don't think that we can just turn the news off. It's just find reliable sources and know the tactics that are out there that makes us feel alone. It made me very proud to see the protests. I was like, this is where everyone's at. This is great. So that's what I've been talking a lot about. And to regulate myself. As a practitioner, I have to understand that I'm gonna have countertransference. I'm gonna have to regulate. This is my yoga time, my walking time. I gotta take this personal day off. I got to take time for myself. So everyone in this room, you've gotta take a break. You gotta have time for yourself. Know that this is hard. And we're being gaslit and misunderstood. And we sometimes can perceive to be on that island. We're not. Look at this room.
Yeah, I agree. So it's not completely disconnecting from the world around us. It's finding those safe sources that you want to look into to keep up to date. It's limiting and just being mindful of how and when you're taking it in, like maybe not reading it right before you're going to bed. Yeah. So watch the doom scrolling on the social media. So find the good stories. Find the good stories. There's so much light and good work being done. Find things that inspire you and get involved, reach out to those people. You'll be surprised how far just dropping a message to someone that you've never met will go. I have made beautiful connections to people that I never thought would message me back just because I sent them an email and said, I like your work. Little moments of gratitude can go a really long way. When I speak about the mindfulness and the gratitude, it is not from a toxic positivity way. I am very big on clarifying that. It is not like, we're ignoring everything and it'll be fine. It is hard out there. we see is hard, and how do we still take care of ourselves and find the good within that hard? And I think we have to be very careful not to ignore it and not to shame and guilt away from that. It can be really damaging if we're not acknowledging that it is hard and scary. Our young adults are getting slammed. I work with a lot of young adults in college, and it is terrifying. Things are changing for them all the time, and I can't fix that. I can't. And a lot of times it's just sitting with people, knowing you can't fix these things, but we can sit with people and just being with them. They know you can't fix it. You can't fix that ruling right now, but sharing what's going on with them and just being with them and just being compassionate, that they're just in a different world than we were in, and just offering them hope and a safe space to talk and just have whatever feelings they're gonna have goes so far. But to know that it is hard for people out there. Just know you're safe providers. I always encourage all my parents especially, but anyone seeing a provider, please ask questions. Please ask questions before you open up. You have that right, and if it doesn't feel right, go find someone else. Know if they're affirming, know that they are safe people. You have every right to ask that before you seek your care. So I'm always big on empowering anyone receiving services, that if it doesn't feel right, if you don't think they're on your side, bounce out of there. They're serving you, not the other way around. So ask those questions, especially these days, to make sure they're affirming. If you have young kids that are seeking care on their behalf, make sure those providers are safe for you and your family. So just ask the questions and then practice that self-care. Have fun. Still find the lightness, find the joy. Go for a walk, play games, be silly. Don't let the heaviness weigh us down all the time.
So a couple audience questions that I want to kind of get in, and this is to Kelle, and this one's pretty specific. Are trans people still required to get a therapist's recommendation to begin hormone replacement therapy or other affirmative care?
At Help Center, they are not. They are not at all. So we have two wonderful providers. We have a provider in Arlington who is trained through Fenway program, nurse practitioner, and then I have another nurse practitioner in Fort Worth that are excellent with gender affirming care, and that is not a requirement for our organization. I can't speak
Just for surgeries.
other organizations, just for surgeries. Yeah.
And then just another specific question to Kelle. This question was, do we partner with a Ryan White program?
We do not partner with Ryan White. We don't depend on Ryan White funding. We are solely funded through 340B funding is how our healthcare services funding program works. So we do not partner with Ryan White. There's lots of restrictions that would probably limit some of the care that we could provide if we did.
And just to add on that, the Ryan White funding is a very specific funding source. Yeah, I think we're relatively unique and not in our line of work with not taking Ryan White as well or being in that space. But yeah. And then this question, I guess this is really to everybody, so y'all can start however you want. The HOPE Act opened the door for HIV positive organ and blood donations and transplants. What impact do you see it having on reducing stigma and saving lives? And how can we as a community raise awareness of that this has changed?
I need to read my Substack.
Yeah, I better go back.
My understanding is that is a law that HIV positive individuals can now be transplant donors. Is that correct? And give blood, and that was not the case previously?
I think that it's if they have tested positive, but it is well managed and undetectable.
Okay. Yeah, undetectable viral load.
Is it that they can be a donor, that they can be a recipient, or both ways?
I'm not 100% sure about that.
Okay. I'll
I feel like
I'll
I
pick
should,
it up on that.
I should know that. and I
My
don't.
next read, I think, yeah, give me.
Yeah, so.
I expect a briefing no more than the first thing.
Kelly is higher than me on the pecking order, so. Okay, well, I'll research that. So
No, I
sorry.
do.
It maybe
Go ahead.
also has a little something to do with, all the questions that they ask when you go to donate blood. So if you live with somebody who is HIV positive, or if you have had a same-sex relationship in the past, sometimes you can be denied whether you're positive or not. So I think that that's also part of that code.
Correct, and I know that still stands in Texas, unfortunately, that question is still on blood donation.
So, and that's interesting because.
Idiotic.
I don't know the answer to that question, but my wife is German, and I know there's a big debate in Germany to open up blood donation, and I think that's recently changed, so that's usual. Texas is behind the curve.
I think that question speaks to just things change quickly, right? And as providers and as an employee, we need to stay in touch, stay educated. We also need to say when we don't know, be okay saying that, and then go getting the information. So I'd be concerned if someone tried to plow through it and like act like they didn't know, versus saying, I'm not sure, let me go find the information and get back to you, because things are changing all the time. So I'm always learning new things, I'm always taking trainings, because stuff changes so quickly. So I'll look into that, it's fantastic.
So this question is to Katie and Kate. What suggestions do you have for how to support a partner who is resistant to mental health services?
Yeah, I mean, I think you start the conversation slowly. You see the positives where you can. It is common, I hear it a lot, that one partner wants to do counseling and one doesn't. And just being gentle with that, being curious, understanding goes a long way. So when we go into the people get defensive and the walls go up and we've lost them. Versus if you can come towards them and say, okay, tell me more. Why don't you want to? What's going on? Tell me where the resistance is, and truly being compassionate, understanding, and not like putting it in your back pocket for later can help that conversation start. I get a lot of people that come to see me, they're like, you are my 5th therapist, if it doesn't work, I'm out. I'm like, cool, no pressure. So like religious trauma, I have a lot of people that have had really, really bad mental health experiences. It's real, it happens, I take it very, very seriously, and I work very slowly with people to not go to the biggest traumas, because it takes time to build that trust. So the same thing is real in partnership, building that trust. Go do your own work first. You don't have to wait. If you want to go see your own services first, go seek your own. Look for a therapist together. Every part of that is a step of the journey. Even if you're just looking up the therapist together, you've started the process. So finding those small wins, not just focusing on the big end issue, can help both people feel seen and heard, like you're making some progress. But yeah, just being compassionate and understanding can help.
Sometimes it helps to let them know what therapy can be, because sometimes it's just communication or a skill set. This doesn't mean, oh, I'm blaming you and I'm all right. And I think if we could just break that down, like explain what cognitive behavioral therapy might be, what the skill set of communication, just giving some examples so they don't feel like this is, oh, we're gonna be on a couch talking about feelings, and it's all your fault, that kind of feeling.
So another one for Kelly. What are the biggest misconceptions you see around LGBTQ plus specific health that are important to dispel?
So I think I touched on this a little bit in my opening, but I think that number one is that people assume that healthcare is healthcare, and you're gonna go to a provider and he's going to recognize all of your needs, he or she's gonna recognize all of your needs and individualize care to you. Frustrating thing I see often, I mean, I use this kind of as a great example, when we had monkeypox outbreak, I had a couple of patients who ended up in the emergency room from severe, real issues from that needed care. And both of these patients in 2 different emergency rooms, one in Fort Worth and one in Dallas, had extensive workups for something that one $77 swab would have answered the question for, but the providers don't even ever take a sexual health history or consider looking into, is this something that potentially could be related, you know, to a sexual health activity or, you know, something like that. You know, I get so many patients come in to me that say, you know, I tried to talk to my primary care doctor about PrEP, but he doesn't know enough about it, or he's not comfortable, she's not comfortable prescribing it for me, told me I would have to go somewhere else. We did a recent survey, our LGBT community survey, and 40% of individuals who participated in the survey state that they're not out to their primary care provider. And that's, you know, that's sad. Less than a third feel that their provider is competent in LGBTQ plus care. We have a list of resources we keep for patients, and we're constantly adding to that list. And when we get a lot of feedback from our patients on primary care providers that are LGBT friendly and competent, specialists in the area, and I really work in building those relationships so that we can identify those individuals and we can refer directly to, and that's been really huge, I think, for our organization. I would love to see at some point that we could expand in doing that for primary care. It's just that little piece of how we kind of do and how we survive off our 340B revenue makes that a little difficult, but is a long-term goal of mine, I will say, because it is a definite need in Tarrant County, especially. So that's what I would say.
Thank you. I think this question is to Katie, Kate, but maybe it's to everybody. Are there support groups for dementia caregivers? This could also be the next panel maybe, but yeah, that was a question.
For the caregiver.
Yes, for the caregivers.
Yeah, the Alzheimer's Association has great caregiver support, both virtually and in person. They have both local chapters and national chapters. I know the people through my network. So if you can't find a resource, find a social worker. I'm passionate about connecting people to the right places. But yes, there is support out there. So please take care of yourself. That's a big goal, and there's a lot that goes into that.
Another question I have templated is, so the help center we do telehealth, and I guess this is the whole panel, but what do you see as the strengths and weaknesses of telehealth, if there are any, and how do you see that? Do you see that expanding going forward? Where do you see the future of telehealth going, specifically with services like that health provides or that are really relevant to the LGBTQ plus community?
I think Kelly also addressed it earlier. You know, this is great for patients that might be, or non-citizens, people that might be a little concerned about actually coming physically in the building, or people that you know, might have difficulty finding transportation. I really think this is the new wave. We have to have virtual going for just about every service you can think of. But I'm kind of a hybrid. I have half and half in my practice, and I don't know about the medical side, but
Yeah, I really, really enjoy it. I was surprised. I thought there might be more barriers working with people virtually, but there are other benefits, like people being more comfortable in their own space, the accessibility of not having to drive. So there's a lot of pros that go with it.
or if they're a caregiver.
Yeah, if they're a caregiver, just a variety of reasons, and I'm licensed in Texas, New Mexico, and Oklahoma. So people that can't get to me, I can serve anyone in any of those 3 states, and especially being a specific LGBTQIA+ provider, that I think can be valuable for people that just can't get to me, or other provider. They may not have a provider in their community that is affirming. So the accessibility, I think, really, really opens it up. And I also work with a lot of neurodiverse clients who just prefer it. They don't want to come to my office, and that's just fine. We can absolutely do the work virtually, but I do a hybrid of sometimes we're in person, sometimes we're only virtual, but it's really lovely to be able to meet my clients where they're at and really meet their needs, and just that scope of the accessibility is really huge.
For us, from a medical standpoint, so I have 2 full-time providers that strictly just provide telehealth care. That's how large a population we have. we call it teleprep, for our telehealth services. I think telehealth is probably the very best thing that came out of COVID. I do, I think it is the very best thing. It is, if you can imagine, we provide telehealth services across 108 counties in Texas. So individuals who live in rural areas, who are not gonna find services like we provide, are able to get those services with us. They can be on PrEP medication, they can receive their HIV care, they go to a lab, get their lab work done. We have the results, we can connect with them. I mean, literally, for a follow-up appointment, it's very quick, and so it doesn't distract from their daily life, and allows them to stay on PrEP. Additionally, we added, we also have 2 psychiatric nurse practitioners. They do appointments virtually as well. So again, that's just providing, we've got in the counseling that we provide virtually. So I think making care accessible in any way, shape, or form where we can meet the need of the patient is the most critical aspect and goal.
So just a follow-up on that, do you find, and this is actually for both Kate and Kelly, do you find that, especially with some of our rural patients, that the ability to offer teleprep or telehealth offers them, maybe they wouldn't feel safe also in some of those communities accessing the service? Maybe that services aren't available, but also they wouldn't be comfortable accessing them. Is that a common theme, or?
Definitely.
Okay. All right, the next question I have, are you experiencing any changes to challenges within 340B? So I guess this is for the help panelists. Probably Kelly was.
So at this point, with 340B again, I depend on Nathan, and in my daily staying in tune with 340B coalition podcast and news that comes about every day. Right now, we are okay, but we are watching very closely. I mean, there's a lot of legislation out there to restrict how we receive 340B as being an STI grantee, meaning that we're an STI clinic, which allows us our 340B certification. There's a push to remove STI clinics as recipients of 340B program, which would be huge. And these are things that people it doesn't get talked about a lot, I feel like, and get publicized out there. But so we're really strongly advocating for that to remain, and pushing for that very strongly so that it doesn't impact our 340B. We also struggle with the drug companies trying to place restrictions on 340B. And so again, monitoring those aspects, we have to keep in tune to that daily.
So just, I don't know if everyone knows what 340B is, so just like a 50,000 foot explainer. 340B is a law passed by Congress in the early 90s, and what it is meant to do, which I would argue the Help Center is like a living embodiment of what it is meant to do, is to expand the services of organizations, grantees, so that they can do more with less, essentially. So the way it's funded is there's classes of drugs, which is most drugs, where the pharmaceutical company has to enter, they enter an agreement with the federal government so that they can, Medicare and Medicaid, which are huge purchasers of all drugs, so that those drug companies can do business essentially with Medicare and Medicaid. And the way it works is the organizations like the Help Center have a drug price that is a reduced price based on the Medicaid price that's negotiated that they receive for the patient. And then the wholesale price, which the drug company has, which is usually much higher, the delta between those goes to the organization providing the care. And that money funds other service lines. So like, for instance, we offer things like, we offer all these services to uninsured patients. That is possible because we have 340B money coming from our insured patients and that delta that exists there. So what Kelly is talking about is just some of the drug companies do not like 340B. They hate it because it cuts into their profits, their enormous profits. they're still enormous profits. And so they're constantly trying to undermine it, frankly. And so there's been a raft of things that have happened over the years, and we don't really need to get into all that, but they're actively trying to take measures to weaken 340B. So I just wanted a baseline because we've heard 340B several times, so sorry, that was a long tangent.
Right, so the medications we prescribe, we have contract pharmacies that we have to contract, so it's actually, we don't get the reimbursement from the drug company, we get it from the pharmacy. So, again, that was a strategic thing. We had it placing our own pharmacy in our organization, 2 years ago, so that is our contract pharmacy, plus we have a handful of other contract pharmacies. And so those pharmacies have to, the reimbursement of that medication comes to us, and that's what we are able to provide our care. That's what pays the salaries of our providers, that's what we cover our labs with for no cost. But an example of how the drug company is affecting that, so in May of this year, the drug company decided that manufactures our medications. So it used to be for the uninsured patients who they had enrolled in a drug assistance program, the reimbursement of that medication would come through the pharmacy as well and down to the covered entity. They pulled those subset of patients out of 340B and are sending them to their own pharmacy. So in other words, that was a $500,000 loss per month for us.
And part of why this is also important is with the recent bill that passed, the big beautiful bill, I hate saying that, but it's called, Medicaid is being slashed throughout the country, and that's disproportionately gonna hit rural providers, because a lot of rural areas have a lot of Medicaid patients. And 340B is a way that small rural clinics, and like Kelly indicated, we have a lot of rural patients as well through our telehealth services, are able to also fund themselves. So you have the hit from Medicaid being cut, and then if 340B, if this encroachment on the 340B continues to happen, that's a real threat to some patients and the services that are being provided. So
Yeah, it's extremely concerning. It's when this happened in May, and you have to understand too, the largest number of our uninsured patients are minority young adults. So they're also not the patients that are gonna be the most compliant. Maybe not, they are compliant because they get a relationship with us, but to answer a phone from a contract pharmacy and then maybe share your information or, be available and then get that medication shipped to you. And the things the drug company doesn't even think about when they started this program, they didn't have one Spanish-speaking personnel in the contract pharmacy, not one. So, just things like that, afterwards that they were like, they just didn't think through and didn't process through. So how it's gonna impact, we will see an increase in the HIV positivity rate. No doubt, no doubt. So that's kind of just where we're sitting back and watching, but just frustrating things like that for our patients. So we're doing our very best to assist our patients in negotiating and communicating with the contract pharmacy, but it's not easy. It's extremely, extremely frustrating for them.
So, ending question to swing back to mental. If given the plummeting insurance rates we're anticipating in this country, what are some strategies you can suggest or ways to access care for somebody that might be uninsured or maybe they have care now, but they're gonna lose their insurance or anticipating losing their insurance? Do you have any suggestions for that type of person?
We do have Pride Life Insurance at our clinic if they're eligible, and I think that's gonna be we're gonna be using that quite a bit. There are payment plans, there are more organizations trying to make, just like we did, we're trying to make counseling available, even if it's short term. I think we're gonna have to advocate, we're gonna have to be an example to get more agencies to see this and do more pro bono. I don't have an answer yet. I don't know.
Yeah, so I made the hard decision when I started my private practice 3 years ago to not take insurance, which is hard coming from someone that has worked in the public schools and with the unhoused for most of my career. But then I'm not tied to those restrictions. So it gives me the flexibility to offer sliding scale and to meet my clients best I can where we are at, and we just have a very honest conversation, because I want people in therapy, but I don't want that to be another burden placed on them that's causing them more distress. And so we just have honest conversations. It's gone pretty well so far. Being able to serve my clients, I hold a couple spots for people that are underinsured, Medicaid, because for me, being just me and my breath, the amount of time and effort it would take to bill and try to go with these insurance, it's just easier for me just to work with people one-on-one. It takes out that middle person, all that extra work. And then me just trying to get ahead of a curve, I don't know how to get ahead of the curve, to work with more community sponsors and more contracts and more underwriters, where all these organizations can help subsidize for my clients directly and putting that back to my clients. So I think it just gets to be creative, kind of like Lisa said, supporting your businesses. Please support your small businesses, because it goes back to our community. And I think things like Aki Detox and group meditations, where you can come in for $15 and be in front of expert level professionals, are gonna be just more and more important. I don't ever want someone who's been a clinician a long time to be behind the elite paywall. Clients can't access me. For me, the people that need, I should work with the highest need clients because of my expertise, and they can often be the hardest to get to. And I wanna switch that narrative. I think it's very backwards within our society that they should be working with those that need it the most. So yeah, just getting creative, working together. Don't be scared to ask if you're seeing a provider or a clinician. Just talk to them. Just have a conversation. And my thing is, if it's not me, I will get you to someone that can. That we are plugged in. We are not competitors. We are all working together here. We're not in competition. It is about getting your needs met, however possible. So if it's not me, I will find a place where you can get those needs met best to your abilities.
I'm also recommending a lot of apps lately. Heavenly and Mood Tools is a cognitive behavioral therapy app, and this works really great in unison with counseling, but it's also, it's like training wheels once you get out. But I think all of us are kind of chat GPTing it up, stacking it up. I mean, if you haven't played around with it, don't be scared. A lot of these are free. You don't have to upgrade on the apps, and I think that's going to be the next step too.
Yeah.
For clarification for the panelists in the center, earlier, did you say Pride Life?
Pride Life Insurance.
Insurance, not medical, insurance, health?
Pride Life is actually an insurance broker that we work with that assists us in enrolling our uninsured patients in an Affordable Care Act program that we're able to cover their subsidy for them. But they're an insurance brokerage. It's called Pride Life.
Thank you.
Yeah, and they'll work with any individual.
And I'm gonna answer this question because I think this is me. I've adopted myself onto this panel. And also because this is the only panel that will clear out the questions on if I answer this. So,
There it is.
how can the community help protect 340B and other funding? For 340B, you can write your legislator at every level. So federally, there are bills, there's nothing moving through Congress right now. I think because they're still hiding from the Epstein file thing, I don't know. They're not there. But the 340B bills are not moving in federal Congress currently, but they could at a time. There's some protection bills for 340B that shores up some of the language so that the pharmaceutical companies can't do some things that they're doing right now. At the state level, there's a slew of states that have passed bills that are mostly, they're called contract pharmacy protection bills. It's getting to what Kelle was talking about. We don't really need to get into all the ins and outs of it, but it basically says, it restricts the pharmaceutical company's ability to say you have to use that pharmacy or you can't use that pharmacy, which is the way that the funding flows through. So in Texas, the Help Center, in the last legislative session, there was a contract pharmacy bill that was working its way, that started in the Texas legislature, that the Help Center supported. We actually submitted testimony on behalf of our organization in favor of that bill. Unfortunately, it got voted out of the Texas House committee and then it died. It didn't go any further. So maybe next legislative session, we collectively, like Texans, will have another bite at that apple. So any calls to Texas legislators saying, hey, we want to protect 340B, I mean, really just saying that is good. So just wanted to answer that question. So we're out of time for this panel. Thank you to everyone, and we got one more.